All right, everybody, welcome to the She Found Motherhood podcast. In today's episode, Dr. Sarah and I, Dr. Alicia, are kind of doing a new thing. We're going to do a Q&A from our most common questions we get asked on our Sunday Q&As on Instagram. So today's podcast, we're talking about spotting, especially in the first trimester. So bleeding in the first trimester. We're going to talk about nausea and vomiting in pregnancy, some tips and tricks, both from a dietary point of view and from medicines. We're also going to chat a little bit about how to help decrease the risk of tearing in childbirth. So, a little bit about perineal massage. We're going to chat about fetal movements, when to feel them, what's normal, when you call your care provider. And last but not least, the thing that starts and ends our pregnancies, hemorrhoids and constipation. What can we do for them? What are they? And how can we help to decrease the impact they have on us? So, we'll get to that all right after this quick reminder.
Welcome to the She Found Motherhood podcast. We are doctors Sarah and Alicia, maternity physicians and moms who have been through it all. We want to empower you with knowledge so you can have the best pregnancy, birth, and postpartum experience you can.
She Found Health and She Found Motherhood is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This information does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or another qualified health provider with any questions you may have regarding a medical condition. The views expressed by She Found Health and She Found Motherhood and our guests are not representative of any of the institutions with which we are affiliated. Some of our podcast episodes are sponsored so that we can keep getting great info out there to you, our listeners. We only partner with companies that we truly believe in. Some of our links and suggestions may be affiliates, and we would appreciate you using them to help fund this important work. Now let's get to it.
So, if you are listening and you're also a follower of ours on Instagram, you will know that every Sunday, I think we've done it for like almost every Sunday, except for maybe one Mother's Day or something. We're so committed. We do a Q&A. So we throw up a question box and our community sends us so many questions and we just don't have the capacity to answer them all. So we thought we would try and answer some of them through our podcasts. So we'll be doing a number of these episodes over the coming months. And what we're going to do is try and answer the most common questions that we get asked on our Sunday Q&As. So first question, spotting in the first trimester. What causes it? When should I worry? When should I call my provider? Take it away, Alicia.
This is such a loaded question.
It is.
There are so many reasons you can have spotting in your first trimester, and some of them are worrisome and some of them are not, but oftentimes it's hard to know until we see that cute little baby on ultrasound or hear them in the office. So first trimester bleeding, some of the more common reasons is our cervix changes in pregnancy, and the cells on the inside of our uterus kind of travel to the outside of the uterus. And as you can imagine, those cells on the inside of your uterus that are lining the uterus, the ones that you build up every month and bleed when you have a period, also are the ones that your placenta attaches to. So there's a lot of vascularity, a lot of blood vessels there, which is normal and fine and really necessary. When they travel to the outside of the cervix due to the kind of pregnancy hormones, sometimes that can get boinked a bit if a penis or something else hits it, and it can bleed a little bit. Now, this isn't worrisome. It's not dangerous. It's very far away from your pregnancy, but obviously it can be very anxiety provoking. So that's certainly one reason that we can have some spotting in the first trimester. If you've had some intercourse or a toy or something in your vagina and it's hit those cells, it can cause a little bit of bleeding. Usually that's spotting for a day or two and then it goes away. Another super common reason, again, most of the time is not worrisome to your pregnancy, is when there's a little bit of a detachment of your placenta from the uterine wall. And usually these are very mild, but can cause spotting for a few days, maybe a little bit longer, maybe up to a week, and then tend to resolve. And we can often see them on the ultrasound that we get. So those are two of the more common reasons that are not worrisome or do not cause trouble in pregnancy. But we usually do like to have a look at your cervix to see if you have those cells on the outside and get an ultrasound just to kind of confirm that everything is fine with your baby. And sometimes we can see those little kind of separation of your placenta from your uterine wall.
So, like Alicia said, those are two of the most common non-worrisome causes. The more worrisome things most people would know would be natural pregnancy loss, otherwise referred to as miscarriage. And so, unfortunately, we can't tell just by the description of your spotting what's happening. So, like Alicia said, we have to get an ultrasound and see what's happening in there. I've had people call me and they have light spotting, minimal cramping, and they've actually had a pregnancy loss. I've had other people call me with, you know, very significant bleeding and everything's fine.
That's wild.
So, we just can't know. So I always tell people that it could be a pregnancy loss, but not to get worried until we get those ultrasounds and have a look and make sure the baby's growing well. Another really worrisome cause, which again is quite rare, is something called an ectopic pregnancy. So, ectopic just sort of means outside of where it should be, right? So, a pregnancy that's implanted in the fallopian tube or somewhere else, sometimes just up in the high corner of the uterus instead of in the lining itself. This is most often associated with significant pain as well. So, if you're having pain, and bleeding, and we haven't had another ultrasound that's confirmed that there's something growing inside your uterus, then this is considered an emergency, and we would want to urgently get an ultrasound done. Those are sort of the two most worrisome causes for first trimester bleeding, and then there's all other sorts of like implantation bleed, which is kind of vague and earlier on.
Sometimes we have no idea what causes the
Oh,
bleeding,
so many times we have no
but
idea.
the pregnancy progresses on normally.
Yeah.
So, yeah. So the most important thing is touch base with your care provider. If you are having significant pain with the bleeding,
Mm.
sometimes it's worth an emergency
Yeah.
visit if you're close to an emergency because they
Yeah.
can have a quick ultrasound to confirm if the pregnancy is in the uterus or not. Obviously, if you're having heavy, heavy bleeding, like soaking through a pad an hour for 4 hours, that's an urgent visit. That's
Yeah.
not a wait the next day to talk to your care provider. But if you're having some mild spotting with maybe a bit of cramping, usually touching base with your care provider within a day or two just to see them and get an ultrasound ordered and blood work if necessary for your blood type, depending on how far along you are, is really important to do.
Yeah. Yeah. And I think the most important thing to know is that don't try not to worry, right?
Easier
It's
said
like
than done.
so much easier said than done, but we just can't know. But always call us, right? Any spotting and we can help figure out what might be going on. Emergency calls in the middle of the night, if you're having that heavy, heavy bleeding, pain with bleeding. Otherwise, check in with your provider within the next day or two.
Yeah. So the next most common question we get, again, kind of in that first trimester, unfortunately for some people, it does last throughout their pregnancy, or kind of what are some tips for nausea and vomiting of pregnancy? And so we've done a ton of podcasts on this. We've done
Yeah.
one on kind of more medicinal, so medication, and we've done one with Noelle from Nourish Beginnings around kind of food that you can use in that first trimester. So we'll summarize a little bit. So essentially, this is from the pregnancy hormone that is causing that nausea and vomiting. So it's a reassuring sign in early pregnancy if you are nauseous, generally speaking. So sometimes just
Yeah.
knowing that, rechecking your mindset can be really beneficial. It's actually a very reassuring sign. Some of the things that we can do from a non-medicine point of view is, oftentimes it's having something in your stomach will help that. So if you get hungry, you often get more nauseous. So having small snacks throughout the day, pairing a protein with your carbohydrate, so crackers with peanut butter or apple and cheese can just help kind of keep something in your stomach a little bit longer. We often crave carbohydrates, so if you can pair it with a protein, that's often beneficial for preventing it from coming back in a little bit. And then ginger has been actually shown to help, so you can have a ginger tea or a ginger lozenge. The other thing that's helped, and Noelle kind of taught, I think both of us this is citrus or sour stuff.
Yeah.
A green apple or putting some lemon or lime in your water and sipping that throughout the day can help. Also, some people swear by those lemon candies, again, a
Yeah.
lozenge just to suck on. And then another thing that's important to remember, and Sarah will talk a little bit more about medications, is oftentimes it's worsened if we have heartburn. And because of the progesterone, the progestation, again, good thing for pregnancy, we can get a little bit more heartburn in those early stages, which can worsen kind of that nausea and vomiting in pregnancy.
So if you're doing all those things at home with the food and, small sips of water, and you're still really symptomatic, so still feeling unwell, medications are definitely an option, and there's lots of safe options. So if you're just feeling nauseous at night, you can take Gravol. That's totally safe in pregnancy. The most common medication we prescribe here in Canada is called diclectin, and it's simply a combination of vitamin B6 and an antihistamine, and it can work really well. It can be quite sedating, but that's our first line medication that we would go to, and it works really well for most people's mild nausea and vomiting. So people who are mild but affected enough that they're, unable to get through the day without vomiting, that's not okay. Then there's other more, a number of other medications that we can use if your symptoms are not controlled with diclectin. And these just include other common anti-nausea medications. So Maxarin is one, ondansetron is another. And those are things that you can ask your provider about if the diclectin isn't enough. And like Alicia said, there are safe medications for heartburn. You can take a few Tums, but generally speaking, they're not that effective. So getting a prescription for one of the medications that we have, like ranitidine or famotidine or a proton pump inhibitor, can really help. And some people actually all they need to take is a medication for reflux, and it just helps calm the reflux down enough. And then they do all the lifestyle changes as well that they manage. And most people, it clears by sort of that 12 to 15 weeks. About 20 to 30% of pregnant people are stuck with it for the whole pregnancy.
Gross. And then certainly if you're not able to keep any fluids down, if you're
Yeah.
continually vomiting despite being on these medications, sometimes we do have to admit people for
Yeah.
2 to 3 days for IV hydration, and we give them all their meds intravenously, and then we slowly transition them back to oral. And it takes that kind of reset to get them so that they can manage at home on oral medication. So certainly if you're really struggling, you can't keep things down, you're dehydrated, despite being on all of the medications, let your care provider know, because sometimes we do need a couple days of admission into the hospital to kind of just reset things and get you so you can get back home and start eating and taking in fluids again. And the biggest thing is the fluids. So
Yeah. Yeah. Alicia has one other great tip about gummy vitamins, right?
oh, yeah. So prenatal vitamins, those big old horse pills with
They're so big.
with iron in them, often make people really nauseous. And so really all you need is a kid's chewable or gummy vitamin and folic acid. So if you find that when you take your prenatal vitamin, you're getting really nauseous, then just go out and buy some kids chewable vitamins or kids gummy vitamins. We want the kids one because it's got less vitamin A than the adult, and then a folic acid. And then hopefully you can make it through. Do that. Heck, if you want to do that the whole pregnancy, is
Totally.
totally fine.
Totally.
Iron is not absorbed from your prenatal vitamins very well anyway, so if you need to take an iron supplement, we usually ask you to take one on top of your prenatal vitamins regardless.
So we'll we have a podcast that goes into a lot of detail around this. It was the first one we ever did.
Yeah.
So we'll link that below
Because it's so common.
because it's so common.
Yeah. Hey, Sarah,
Yes, Alicia.
do you ever find that people bring in their birth plans to show you in the office and they're not even hitting the important points?
I do. And I think that they don't even consider all the options when really we often don't have any idea of what to expect going into labor.
Agree. So what we did was we put together a free birth plan download, but we also put together a little course about how you can fill it out, talking about what the real purpose of a birth plan should be and how it can really help you have the best birth you can.
We've got an area that covers your medical history and your pregnancy, and then we've got a section that helps you walk through and figure out when you might accept certain interventions. Not just yes or no, but at what point and at what stage in your labor and birth experience.
We go over some examples through case studies to help you get an idea of what this could look like. And we also think it's really important to use your birth plan as a jumping off point for conversations with your partner and your provider. And we talk a little bit about how you can start doing this with our birth plan course.
Absolutely. If you're interested in learning more, head to our website, www.shefoundhealth.com/courses.
See you there.
So question number 3, how do you prevent tearing in birth? And if I had a bad tear, will I tear again? So this is such a common concern. And I think I would just start by saying, like, most people have some tearing in childbirth. You know,
Especially in your first.
yeah, there's sort of 4 degrees of tearing. The first, I just describe it as like you scraped your vagina. The second, it tears into the muscles a little bit. The third, it tears through the muscles and then a little bit to the muscles that surround your anus as well. And the fourth is all the way through the muscles in your perineum and through your anus. Third and fourth are way less common, and it's the first and second degrees that we see most frequently, especially in your first. So I don't think we did a podcast, but we do have a handout about perineal massage.
Yeah, it's a great one. So we'll link it below. So make
Yeah.
sure you sign up for it and you'll get sent it in your email.
Yeah, and perineal massage, there is some evidence that it helps prevent complex tears, so those third and fourth degree tears, and it also helps reduce the risk of needing an episiotomy. And so we won't go into detail about how to do it here because it's clearly really well laid out in that handout. So download that. And a lot of people ask, if I had a bad tear, will I tear again? And what if I'm going into my second pregnancy? Is there any point in doing perineal massage? The evidence isn't as clear, but I was thinking about this the other day after I delivered somebody whose scar tissue opened up,
Mhm.
right? And so we so commonly see that, and that the scar tissue just isn't as flexible and as, I don't know the right word.
Yeah.
So I was thinking, like, there's no evidence, but doing perineal massage might help soften that scar tissue a bit.
Yeah, or even just scar massage too.
Scar massage, right?
Pelvic physio is great
Yeah.
as well.
Yeah.
And so if you don't know how to do it or you feel uncomfortable, then go see a pelvic physio and they'll help support you in learning it. And the whole point is that you're stretching out those tissues. So warning, it's
doesn't feel
uncomfortable.
good.
It doesn't feel good. And certainly another thing to think about, if you're a person who has a history of trauma, um, this might be triggering for you as well. So
Yeah.
so just if you are doing it or you're needing a partner to support you in it and you do have a history of trauma, just go into it a little bit aware of that, and what a great opportunity to talk to your partner about if you haven't, or if you're going to see pelvic physiotherapists, let them know that you have a history of trauma, and so they'll walk you through it a little bit. I mean, they're always great, don't get me wrong, but it's just nice for us as care providers to know if there's specific things that might be triggering for you, so we can try to walk you through it, or we can avoid it, right? So it's not something you have to do. If it's uncomfortable for you in a physical or psychological way, then don't do it. That's okay. But if you're looking for something to do and you're able to do it, wonderful.
Mm-hmm.
But again, we have that great free download, so we'll link it in the show notes below, so check it out. Number 4, fetal movements. So when do you start feeling them? What's normal? What's not? When do I go to the hospital? So again, we'll quickly kind of go through this. Obviously, talk to your care provider because everybody has a bit of a different way that they would like to hear from you about fetal movements. But generally speaking, most people start to feel movements around 16 to 22 weeks,
Yeah.
probably more like 19 to 20 weeks for your first pregnancy, a little bit earlier for subsequent pregnancies. But they're certainly not consistent at that stage of the game. And they don't usually get consistent until about 28 to 30 weeks. And so at that point, we start to get people to just be aware of the movement. So we're not talking about doing fetal movement counts all of the time, but being aware of your baby's patterns. And this baby will be different from another baby, and that's totally fine. So if you start to notice that your baby's pattern is XYZ, and then one day baby is much quieter than you expect, that's when we want you to sit down and do a fetal movement count. So this is when you sit down, you put your feet up, you get a cold glass of water, and you really focus on your baby's movement. So you're not watching shows, you're not on your phone scrolling, you're really paying attention to your baby, and you're expecting, most of us say 6 to 10 movements within a 2-hour period. Now, that may happen in the first 15 minutes. If so, great. Get up, be done. You don't need to sit there for 2 more hours. But babies also have sleep-wake cycles that are about 45 minutes, which you'll find out when your baby is born. And so they may be sleeping for the first 45 minutes and then they wake up. So it takes an hour and a half to get those movements. And that's okay. It's okay to take up to 2 hours for those 6 to 10 movements. But if you're not getting them at that stage, that's when you should be calling your care provider. So depending on what your system is where you're giving birth, that might be, I don't know what everybody's system is, but we certainly have an on-call number for emergent situations. So we would consider, not an appropriate fetal movement count after 28 to 30 weeks with a full 2-hour sit down and focus on your baby, an on-call, emergent on-call thing, and we'll get you to come into the hospital and have a listen to baby and just make sure that all is well. And if you're really, really worried, then
Just come in.
just come in. If you're after that 28 to 30 week mark and you have done your 2-hour kick count and you're not getting it, then just come in and be safe about it. Don't sit around. We'd rather see you and everything be normal than you be sitting at home not wanting to come in and bother anybody and something actually happens. So
Yeah.
Anything I missed on that?
No. The only thing I would say is that as baby grows, the movements change, but they should still be moving. So when your baby's like 38 weeks, you're not gonna feel those,
They're very squished in there.
right? Those jabs. You feel baby sort of rolling around. So the movements will change, but as long as they're consistently happening and you're feeling them, that's fine. It's when they decrease in frequency that we want to hear from you.
Yeah, I get questions around people having
Yeah.
like, I have so much movement. Is that bad?
Oh no.
fine.
Yeah, we get that question all the
I
time.
mean, you might have a very
Busy
rambunctious toddler, but no, that is like, no.
No
Too
much movement, too much
Yeah,
movement.
exactly.
Yeah. Okay.
Exactly.
Last question for today. Hemorrhoids and constipation. Help. I think you did a podcast on this.
Yeah, sure did, but
Yeah, right? So we're going to link that below. But basically, they're super common. Okay, so ask your provider. Do not be embarrassed. They happen, constipation happens for most pregnant people and hemorrhoids as well. And the reason being is that beautiful hormone, progestation, slows everything down, including your bowels. So that combined with probably as you get more pregnant, you're less physically active, your blood volume increases, if your water intake doesn't keep up, all these things can combine to promote constipation, and then constipation along with the pressure of your uterus on your veins and your hemorrhoidal venous plexus causes your hemorrhoids. So,
Your HVP.
right? Fancy words. Everyone has hemorrhoids, by the way. They're just a venous plexus. You're just symptomatic or not. So don't be embarrassed, okay? So tips are just drink water. Drink water until your urine is light yellow to clear is what I tell people.
Mhm.
There's no set amount. Have a diet that's nice and high in fiber. Move a lot. So walking, get yourself a squatty potty. We'll link one of those in the show notes below. And so that is
See your pelvic physiotherapist.
Yes,
as well.
they can help with constipation. And then there's some medications that can be helpful.
Yeah.
Over the counter.
Yeah, and PEG 3350, or also known as Restorelax or Laxaday, Miralax. I'm sure there's other lax.
Yeah.
Are totally safe in pregnancy. So chat with your care provider, but that's often our first go-to if extra fiber, extra water, squatty potty, pelvic physio isn't helping. And also a great one to have on hand after. But yeah, so that's it. In a nutshell, we went through the entire spectrum of pregnancy there.
We did. Actually, what a nice order to put things in. Right? We're so clever.
Yeah, so we hope this was helpful. If so, and you have other questions, then keep them coming. We love hearing questions, and we'll do like this kind of regular type of Q&A if people find this helpful and we get some good feedback. If you did find it great, head on over to our iTunes page and leave us a review, because that is such a wonderful way for us to know that these podcasts are valuable to people.
And share them with a friend.
Yeah.
Pregnant, trying to get pregnant, postpartum. We cover it all.
Thanks for listening. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our community for weekly bump blasts. Make sure to check us out on Instagram or Facebook at she.found.motherhood, and head on over to your favorite podcast app and leave a review and a 5-star rating. If you enjoyed this podcast, take a pic of yourself listening to it and share it on social. Make sure to tag us on it so we know to keep making them.